Honorable Ahmed Lamin Samate, the Director of Health Services, Dr. Dike, the Director of Pharmaceutical Services, Bawani Sabali, Deputy Director of Health Services, CMD, DFSTA, and we also have the Deputy Executive Director of NCA and the Registrar of the Pharmacy Council, Mr. Morgay. Colleagues from the media, we want to welcome all of you to this important press briefing in which the Honorable Minister will give an update with relation to AKI, and we'll also have a question and answer session. And as usual, when the Minister made a statement, we also follow it with a question and answer session. And I want that, as usual, how we have been doing it, we make it so organized that at least everybody will understand why we are here. So we listen to each other, we take our time, and we ask the questions that we are asking, and for sure you get the right response. So the people who matter are all here, so you get the right. And all the questions doesn't mean that we'll be directed to the minister, but when you just raise your question and then where it will be answered, it will be answered to your satisfaction. On that note, I now invite the Honorable Minister of Health, Honorable Ahmed Lamin Samate, to give his statement, but also we'll do it in such a way that the first part will be English language, because we want the general understanding of the entire population, so it will also be in local languages after the English summary. Thank you.
Thank you very much, Mr. Chair. Good evening, colleagues. Good evening, ladies and gentlemen of the media. We are gathered here today, this evening, to have a press briefing with regards to the acute kidney injury cases in the country that we've been seeing in the recent past, even though we are still seeing them. And equally speaking, to have interactions with the media so that the people of this country, our beloved country, know what is happening. But we first of all start by extending our deepest condolences to the families who lost their loved ones to acute kidney injury in the Gambia in the past almost 3 months. It has been a very difficult period for the families. It has been a very difficult period for the whole country. It has been a very difficult period for the health workers. It has been a very difficult period for His Excellency, the President, and his entire government. This is a phenomenon we had never seen in this country before. And it has stretched us very far and stretched us to the limits. To the families, we say, we share your sorrow, we share your sadness, we share your sleepless nights. And may the Almighty Allah grant the loved ones that have passed away at Jannatul Firdaus, and may Allah give you the fortitude to bear the loss. I must say, this includes my own family. I lost a nephew to acute kidney injury on Wednesday. This shows that no one is exempt when there are health disasters, when there are health emergencies. As long as we are all human beings, health emergencies concern us all. At this juncture, I would like to mention here, we thank His Excellency, the President of the Republic, Mr. Adam Barrow, for coming out yesterday to engage the people of his country in the presidential statement, which goes to extend condolences to the families, which equally indicated the situation of acute kidney injury in the Gambia, equally what had transpired with regards to the occurrences of the cases, what had also transpired with regards to the care and attention the patients had received, what had also transpired with regards to the investigations until we were able to have a direction as to the possible cause of acute kidney injury, the acute kidney injury in the children, and what his government had done, is doing, and will be doing. However, at this juncture, the statement by His Excellency, the President, with regards to the statistics, was by no means intended to be insensitive. He was actually portraying the disease trend, explaining to the people of this country a new phenomenon that we had not seen, but it was by no means meant to be insensitive. And we have realized that some people took offense in that paragraph, and we wish to sincerely apologize for that paragraph. And as his advisors, we take full responsibility of that statement. The intention was to explain to the people of the country the disease pattern, but not to be insensitive to the loss of lives in the country. As he emphasized, loss of a single life is one too many. It is never the wish of any leader, whether it's a leader of a compound, a leader of a town or a village, or a leader of a nation, to lose a single life in his country, compound, or household. And as a parent, His Excellency the President feels your pain. He feels the loss of loved ones. He has had a personal experience of that in the past, a number of years ago, and he knows how it feels to lose a son or daughter at a tender age. The welfare of this country, the welfare of the citizenry of this country, is His Excellency's topmost priority, and he will continue to endeavor to ensure that the people of this country receive the best. And the provision of the healthcare services of this country, ensuring that the people get the best of care, has been very high on his agenda. The hospital, before and even during this AKI outbreak, has received a lot of support as the physicians, the doctors, and the nurses, and all the support staff tried to support these children who were sick. His Excellency's government was at the forefront providing support, providing medical equipment. Items were brought in very, very urgently within short notices to ensure these patients get the best of care. Within the last 2 months, 9 hemodialysis machines have been bought. 2 of them are specifically for children. We've never had specific hemodialysis machines for children, and we can say a lot has been done, and we thank His Excellency for the support. We thank the doctors at the Edward Francis Small Teaching Hospital, the nurses, the laboratory scientists, the pharmacists, all the caregivers at the Edward Francis Small Teaching Hospital who participated in the treatment of these patients. Acute kidney injury, as we are aware, is a very devastating illness, even in adults, talk less of in children. We had elaborated on the possible causes. As we mentioned earlier, initially, the thought was that it's a bacterial infection that was causing it, in addition to the diarrhea and vomiting that this patient presented with. But as we looked at the trend, we realized that many of these children had also been given drugs. And a pattern became clearer. And with the experience of the experts we have at Edward Francis Small Teaching Hospital, that enhanced our clinical acumen to pick these cases at the point they were picked. We had to do quite a lot at the hospital, but a lot could also not be done in the country because this is a developing country. We do not have all the resources. But I must tell you that government is doing all what we can do to ensure that this country gets all the resources that are required to deal with such cases. It has not been easy, but I wish to extend His Excellency's unflinching commitment to ensure that the health facilities of this country are the best in the region. To further expand his commitment to the health facilities of this country, he ensures that his family attends health services, obtains health services from the Edward Francis Small Teaching Hospital. His own daughter was admitted there, and the First Lady was with the daughter there for a number of days, just like any other mother and a child. His mother also was admitted there and received treatment from that place. That shows that he doesn't belittle our system, but he shows his commitment to the system, and he says, whatever is good for the people of the country is good for his family. Whatever is bad for the people of the country is also bad for his family. So just to emphasize the commitment. To the bereaved families, His Excellency has put up a high-powered delegation who will be meeting with them, who will pay a condolence visit and update them on the steps government is taking. We want to tell you equally that as we speak, drugs that have been found to be contaminated so that they are engaged in the usual way when such things happen. We also want to inform you that the police has already started work. The officials of the Medicines Control Agency and the importers of these drugs have already been invited to the police headquarters to help the police in further investigations. The license of the importer of the drugs, under the instruction of His Excellency, has been suspended as we speak to you. We have seen that the outbreak of acute kidney injury is contained now. We are no longer seeing many cases, and that is a good sign of containment. The total number of patients who had acute kidney injury as we speak is 81, and on receiving the mortality figures from Senegal as well, where some of the patients were taken to, we now have a total mortality of 69. Distinguished ladies and gentlemen, this is a very difficult time for the entire country. This is a very difficult time, a time that needs us to work together as a nation, a time that needs us to support the health workers, continue the investigations, because the investigations of these causes of death or the cause of death of these children is not concluded yet, because there are a lot of other things that need to be done to know exactly the cause of death, the cause of acute kidney injury, and the cause of death of these children, even though we highly suspect the contaminated medicinal products. Our epidemiologists and other health workers are working with teams from the WHO, World Health Organization, and the Center for Disease Control in America. And amongst them, we have anthropologists and epidemiologists who have vast experience in issues of such nature. And these individuals are all working with our teams to ensure that the investigations yield results that government can act on decisively. We assure you that government will do whatever is possible, inshallah, to get to the root of this, and decisive actions will be taken based on the findings. In a related development, the World Bank has pledged to help the Gambia put up a drug quality laboratory, a food and drug quality laboratory, so that we do not see these kinds of problems again in the future in this country. Some of the challenges we face as a developing country, because of the poor resources, the Gambia has similar challenges to other developing countries. Many of us do not have quality laboratories to test these drugs on a regular basis. This is a challenge even in some of our bigger neighbors, where some of the samples were sent and they couldn't do it all until we all had to send some samples to other countries. And even with that, there are certain tests that actually take time, because if the contaminant is known or there is a suspected contaminant, it is easier to check if that actually is contained in the sample that you have sent. But if the contaminant is not known at all, they have to test it and match it along with so many other possible toxic contaminants, potential contaminants, and that takes time even in the very advanced countries. The other tests are still also being continued. That is, the isolates, the bacterial isolates from these individuals are also still being tested. Sequencing is being done so that at the end of the day, we can put all these together to get to know the root cause of the acute kidney injury in these children. Once again, I want to appeal to the country, the Gambia, the country that we all share, the country that we are all related, in which we are all related to each other, the country which is the only one we have, the country that we need to build together, the country that we need to develop together. We appeal to each and every one of us to see country first. We work together so that we identify the challenges and we build our nation together. This is a time of sadness. It is a time we should support each other as a country. It is a time we should look for the problems, because we as a country are a victim of this problem. These contaminated drugs were not manufactured here. Nobody ever knew or thought that anyone will think of bringing in contaminated drugs that have the potential of causing harm to individuals, talk less of loss of life. So as a country, we are all victims in this. No government, no president, no minister, no director, no mother, no father, no brother, Nobody ever wants this to happen in his country. So that means this is a time when the country should come together and we see what can we do to avert such problems in the future. What can we do to strengthen our systems? We talk to the partners. Partners have started listening to us. We had been talking before, but we didn't have the resources to have a quality lab here. In fact, we had taken steps to ensure that all medicines in this country are registered. All the importers had been given deadlines. But of course, that had to go with robust quality assurance systems, where we had gaps because we are a low-income country with very little resources. Once again, we wish to say to the families, government is aware of your pain. His Excellency, the President, is aware of your pain. And we all stand by you. Inshallah, we'll get to the root cause of this. Inshallah, it will never happen again in this country. We thank you very much for your kind attention.
Excellent statement, Honorable Minister. Thank you very much. We have listened to the statement of the Honorable Minister, and now we go into the next phase, which is the question and answer session. Now you will tell me, if you want to ask anything, you just raise up your hand. Tell me who you are and which media house you come from. Then from there, then we can ask you the question. And I'll take that 5 at a time. 5 at a time. Yes, you are. Network. Okay, and who else? Landing.
Yes.
Okay.
Freelance.
Freelance.
Yeah.
But attached to which newspaper?
Starting.
Start. Who else again? You want to ask the question? So you are part of the family. Okay, then you don't need to ask. So you can give suggestions and recommendations. Maybe perhaps you can tell us what you are doing at the FSPH. I'll give you that chance. Who else again want to ask? That's all. Good. So, Father Network, you are allowed to give one main question. Well, you know time is late, and then we want to open up as quickly as possible. If that's okay. Please kindly ask your question.
Well, thank you very much, Dr. Samake, for delivering that statement. And my question is, contrary to the WHO report, your ministry issued a press release indicating that 28 children died out of the acute kidney injury. And then Gambians were never alerted about this until the WHO reports are about 66, which actually something is on. And tell us what happened. Your ministry, for them not to detect these 66 until WHO, and what organization was involved?
Okay.
Let's go to the next one. You have London.
Yes. And this is Kefan. My question is, the President authorized for the suspension of the lancing import, the owner of the lancing who imported the medicine in the country. We want to know who, under whose lancing these medicines are imported in the country.
Under whose lancing?
Under whose lancing?
Thank you.
And then my second question is...
No. You have taken the one at a time.
Seriously?
No, you have taken the one at a time. Okay? Then we have started.
Honorable Minister, in 2020, you faced the National Assembly discussion about the ghost account, which was not addressed well. Earlier this year, year, we had the sniper KNS2, which is still under the Ministry of Health. Today, we are discussing about 66 children died of avoidable death. Is your ministry or is your administration prepared to elevate, improve, and also restore the health of Gambians?
Okay. Thank you. Okay. Honorable, I respond to a lot of foreign network with regards to the 28.
Yeah. Thank you very much for the question. I think it is important to first and foremost mention to you that the figure the WHO quoted was our figure. It's from here. It's not from them. The way WHO works, in the country, we have a WHO office, which is headed by we call him WR, that's the WHO resident representative, who is part and parcel of our incident management team meetings. He has been with us, and this data is presented to that meeting in Kotu on a regular basis. There is a presentation of the admissions, the mortality, and whatever is being done for these patients. And a line list is developed, which will tell you the patient, the age, the address, the sex, and then what was taken, the parameters for comparison. And these figures, as they went up, they were actually no secret. They were presented to that meeting, and on a regular basis, the WHO resident representative sent those reports to his bosses in Afro, that's the WHO Regional Office for Africa, in Brazzaville, and to Geneva. We were all working on this together. They sent in experts on our request. Because when countries have such emergencies, that's the work of WHO. That's the mandate, international health. Initially, an expert was sent in called the RED, R-E-D. That's the Regional Emergency Director who is based in Afro. That's the Regional Office for Africa, was sent in. He spent a few days with us here. That was followed by the director responsible for pharmaceuticals and medical supplies of WHO. So we worked with them. So the information WHO came out with was our information. They supported us to do the laboratory tests because of their mandate and their networks. They know which labs can do what tests in the whole world. That's part of their mandate. And they also support countries by conveying the lab samples to these required laboratories. And WHO did that for us in the whole of this process. Some samples were sent to Senegal, then to Ghana, all coordinated by WHO, and then to Geneva, Switzerland, and also to France. Now, when we got the preliminary results, as you are aware, we acted here. We said there should be household recall because the preliminary results for those drugs did indicate that there were contaminants. And we say, even if it is not confirmed, we are going to withdraw them from the households. But we had suspended them, the drugs. We did, so when there are challenges like this, there are international best practices. What you do, then what you do next, then what you do next. These are all best practices that have been outlined by international systems. So when that happened, initially, you remember, we said suspension of paracetamol, promethazine. Thereafter, there was quarantining of the drugs. Thereafter, there was withdrawal. and then there, you know, the household withdrawal and so on and so forth. As we waited, even with the preliminary results, we said we needed to withdraw them because there was some indication, but it was not confirmed because the lab needed to be sure, because these are very, very serious things. Excuse me. Now, as we awaited the confirmatory results, the WHO went ahead to announce. And I must tell you, the WHO Regional Director for Africa and his team, her team, and the WHO country representative extended the message to me apologizing because that was not the protocol, the correct protocol. The correct protocol was for us to get the laboratory result as a country and we come up with an announcement. That is the correct protocol. The WHO team in Gambia and Brazzaville extended their apology because the protocol was for the country to have been notified of the results so that we take immediate action by informing our own citizenry. Then we, WHO, can take that, then we notify the WHO that this is what we have in Gambia, and WHO notifies the world. So the WHO Director General, I'm afraid, did not follow the protocol, and his team themselves thought that was not correct, and they called me to apologize. This is the pattern. Thank you.
Thank you very much. Now we go to this suspension from landing, the suspension of the launching. What next? I hope the import already has the case. Information around the suspension of the launching of the import. On the whose launching, yeah.
Thank you very much. The license that was suspended was under the instruction of His Excellency, and the Medicines Control Agency has the mandate, and the document, I'm sure you will see it somewhere, the suspended license. The Pharmacy Council, Medicines Control Agency people are here. That's why we brought them. Our apologies, we did not introduce the members of the panel, but introduce yourself so that when we pass the questions, you will know who is answering your question. Yeah.
Yes, I am the registrar of the Pharmacy Council.
Yeah.
I am the Deputy Executive Director of Medicines Control Agency.
Yeah.
Babande Savali, Director of National Pharmaceutical Services.
Oh, yeah. My name is Morinja, Director of Health Promotion. Initially, I did the introduction.
Oh.
Okay.
So, and then I introduced
Yes.
them.
Okay, you did. Okay.
So, to get their names if you want to ask.
Dr. Amar Jafari, Chief Medical Director, Edward Francis Worthy Hospital.
I'm Dr. Mamadou Kenya, Chief Deputy Director of Health Services.
Mr. Abide, Director of Health Services.
We also have Deputy Director of Health Promotion is also there.
I'm Sanjay Kawal, Deputy Director.
So I think Madam Fatuja can answer your question. She is there in charge. They suspended that.
The license holder is safe headed.